Mental health problems are almost ignored in Nigeria and some West African countries. Many people can fall into the trap of thinking that if one doesn't experience any symptoms of mental illness, then they should automatically display high well-being. They may also think that fixing what is wrong will automatically lead to greater well-being. However, research suggests that it is far more complicated than that. Nigeria, one of the most densely populated countries in the world, the lack of overall health literacy and human resources due to an ineffectively updated legal and regulatory framework, coupled with very limited but misused budget allocation, are some of the factors responsible for this. The country's constitution recognizes the importance of public health care and stipulates the improvement of public health as an important primary duty of the state.
Mental issues in the military is of a great concern to us. We don't want people with stress disorders, people with trauma, all those kind of things in the military. We want them to be in the right frame of mind to carry out the operations for national security. So we expect that they will find themselves in the operational areas, and then they'll be able to advise the commanders and treat their patients accordingly.
We are looking at resilience, how you handle stress, how you make decisions when you are under stress, and to seek help when you know that you are being overwhelmed by stress, by situations around you, to avoid poor judgment that can lead to loss of life, that can lead to morbidity as well.
Nevertheless, it is often compromised or neglected in favor of other socio-economic development priorities.
My oga carry bike go dey drive okada now sef fuel don cost. Before you buy fuel 1 litre 600 700, you go drive okada, you no go see money to buy food.
They should try, of course, take it as something that is part of life, and do whatever you can to encourage the child. That is not the end of life.
Our experts in medicine, psychiatry, and psychology can actually provide solutions whereby they can live a more decent life.
The Lunacy Act of 1958 was recently repealed and substituted by the Mental Health Act 2021, signed by the former President Muhammadu Buhari on the 5th of January 2022 to fill in various gaps in mental health law.
We had our predecessors who over 35 years have been trying to get a modern mental health law for Nigeria to shift us away from that Lunacy Act of 1914 or 1916 that we inherited from the colonial masters. A very harsh and cruel law that does not really understand the meaning of mental health.
The understanding of Nigeria, of most people, because of our local factor, is that anybody that has mental health is either bewitched or the person has done bad thing, and then the right of that person is taken off from the person. They chain the person, they start beating the person, and it was taken as if it is the norm, which is wrong.
This is a welcome development, but there remains limitations and scope for further improvement.
The Mental Health Act impact would be great for this country. I mean, it's something that, one, now with the law that we have for grant, it means all so-called traditional mental homes where people are treated inhumanly, they've become illegal. And that would mean people that are treated subhumanly, if I can use that word, will stop. That's a great impact because we are returning right to the life of the people. Of course, secondly, with the establishment of the mental health department in the ministry, once funding is provided for it, we are going to have a mental health system that will serve from primary care up to the national care. And then it means you have a focus
for this project is to support government and civil society actors to achieve the mental health objectives in the Nigeria NTD Master Plan and to share this learning in the West African region.
And we want to get more people accessing to the mental health services and the skin NTDs. It's very important, the commitment of the government also.
Nigeria's health and development policy agenda has historically disregarded mental health. Additionally, factors that affect mental health are poorly understood. Discrimination and stigma are pervasive, and individuals who struggle with mental health issues are often mistreated.
There should also be a consolidated focal point and information exchange between key government agencies like the Federal Ministry of Health, National Commission for Persons with Disabilities, and other associated parastatals to help coordinate advocacy and mainstream issues pertaining to those with psychosocial conditions.
Owing to the limited understanding of mental health disorders at the primary health care level, caring for individuals with mental health issues is often entrusted to the family members. Speak up for mental health. Your voice counts.